Vitamin A is a fat-soluble vitamin that is important for maintaining overall health and well-being. Vitamin A is important for maintaining healthy vision because it helps the retina, the light-sensitive tissue at the back of the eye, to function properly. It also plays a role in the formation and maintenance of the cornea, the clear outer layer of the eye. Vitamin A is also essential for a strong immune system. It helps to produce white blood cells, which are important for fighting infections. In addition, it helps to keep the skin and mucous membranes that line some body parts, such as the nose, lungs, and urinary tract, healthy. Vitamin A also plays a role in the growth and development of our cells. It helps to regulate cell division and differentiation, which is important for the normal growth and development of our bodies. It's important to include a variety of vitamin A-rich foods in your diet, and to talk to your healthcare provider about any supplement options. There are several foods that are rich in vitamin A. Animal-based sources, these include liver, egg yolks, and whole milk. These are some of the most concentrated sources of vitamin A, providing very high levels of the nutrient in a single serving. Plant-based sources, these include carrots, sweet potatoes, pumpkins, leafy greens, such as spinach, kale, and collard greens, cantaloupe, apricots, and mangoes. These foods provide a form of vitamin A called beta-carotene, which the body converts into retinol, the active form of vitamin A. Some breakfast cereals, margarines, and other foods are fortified with vitamin A. Fish liver oil is also a good source of vitamin A. It's important to note that when it comes to plant-based sources, cooking can affect the bioavailability of vitamin A, so it's best to consume them raw or lightly cooked to get the most benefits. Vitamin A deficiency is relatively rare in developed countries, but it can occur in people who do not have access to a varied and balanced diet, or in those who have certain medical conditions that affect their ability to absorb fat. The symptoms of vitamin A deficiency can vary depending on the severity of the deficiency, but some common symptoms include night blindness, difficulty seeing in dim light or darkness, dry eyes. Vitamin A deficiency can lead to dryness of the eyes, which can make it more difficult to produce tears. Dry skin. Vitamin A helps to keep the skin moist, so a deficiency can lead to dry, flaky skin. Increased susceptibility to infections. Vitamin A plays a role in the immune system, so a deficiency can make it more difficult to fight off infections. Slow wound healing. Vitamin A is important for the growth and repair of tissues, so a deficiency can slow the healing of wounds. Infertility. Vitamin A deficiency in men can cause infertility by affecting sperm quality. Stunted growth. Vitamin A is important for growth and development, so deficiency may lead to slowed growth in children. It's important to include a variety of vitamin A-rich foods in your diet, and to talk to your healthcare provider about any supplement options if you suspect you have a deficiency. Vitamin A toxicity, also known as hypervitaminosis A, occurs when a person takes in excessive amounts of vitamin A. This can happen from consuming large amounts of vitamin A-rich foods, taking high-dose supplements, or a combination of both. The symptoms of vitamin A toxicity can vary depending on the severity of the overdose, but some common symptoms include headaches, nausea and vomiting, dizziness, fatigue, dry skin, loss of appetite, sleeping problems, irritability, joint and muscle pain, drowsiness, blurred vision, dry, itchy eyes, loss of hair. In severe cases, vitamin A toxicity can lead to liver damage, birth defects, and even death. Long-term use of high doses of vitamin A supplements can also increase the risk of osteoporosis. If you suspect that you have vitamin A toxicity, it's important to seek medical attention immediately. It's important to note that the recommended daily allowances for vitamin A vary depending on age, gender, and pregnancy status, and it's best to talk to a healthcare provider before taking any supplements, especially if you are pregnant or breastfeeding. Thanks for watching, and don't forget to like and subscribe to get more informative videos like this one.